Yersiniosis, an infectious disease caused by a bacterium called Yersinia enterocolytica and, less often, other forms of Yersinia. The infection can cause a variety of symptoms depending on the age of the person infected. Common symptoms in children who most often contract the disease are fever, abdominal pain, and diarrhea, which is often bloody. Symptoms typically develop 4 to 7 days after exposure and may last 1 to 3 weeks or longer. In older children and adults, right-sided abdominal pain and fever may be the predominant symptoms and may be confused with appendicitis. In a small proportion of cases, complications such as skin rash, joint pains, or spread of bacteria to the bloodstream can occur. Yersiniosis is most often acquired by eating contaminated food, especially raw or undercooked pork products. The preparation of raw pork intestines chitlins may be particularly risky. Infants can be infected if their caretakers handle raw chitlins and then do not adequately clean their hands before handling the infant or the infant's toys, bottles, or pacifiers. Drinking contaminated unpasteurized milk or untreated water can also transmit the infection. Occasionally Y enterocolytic infection occurs after contact with infected animals. On rare occasions, it can be transmitted as a result of the bacterium passing from the stools or soiled fingers of one person to the mouth of another person. This may happen when basic hygiene and hand-washing habits are inadequate. Rarely, the organism is transmitted through contaminated blood during a transfusion. Yersiniosis is generally diagnosed by detecting the organism in the stool. The organism can also be recovered from other sites, including the throat, lymph nodes, joint fluid, urine, bile, and blood. Uncomplicated cases of diarrhea due to Y enterocolytica usually resolve on their own without antibiotic treatment. However, in more severe or complicated infections, antibiotics such as aminoglycosides, doxycycline, trimethoprimsulfamethoxazole, or fluoroquinolones may be useful. Most infections with Y enterocolytica are uncomplicated and resolve completely. Occasionally, some persons develop joint pain, most commonly in the knees, ankles or wrists. These joint pains usually develop about 1 month after the initial episode of diarrhea and generally resolve after 1 to 6 months. The skin rash, called erythema nodosum, may also appear on the legs and trunk. This is more common in women. In most cases, erythema nodosum resolves spontaneously within a month. To prevent the infection, avoid eating raw or undercooked pork. Consume only pasteurized milk or milk products. Wash hands with soap and water before eating and preparing food. After contact